Well, the MONARCH-2 study is very impressive, as have been the other CDK inhibitor studies. Abemaciclib, the CDK4/6 inhibitor that was tested in this trial, is a little bit different from the other two drugs, palbociclib and ribociclib. It seems to have more activity against CDK4. It also has activity against the other cyclin-dependent kinases, and so its toxicity profile is different. Its activity profile may be different as well. Now, what was shown in the MONARCH-2 study is very concordant with what has been shown with palbociclib and ribociclib, roughly a doubling of the progression-free survival. The toxicity profile is different. There's more GI toxicity, particularly diarrhea. There's some other aspects about the drug that may be interesting. It may have more penetration in the blood-brain barrier, so it may have an impact on the subsequent development of CNS metastases. Some of the other CDK4/6 inhibitors may also penetrate the blood-brain barrier. It's not clear at this point whether that will be a real advantage. So I think it will be another drug in our armamentarium that we have for hormone receptor positive breast cancers. I think the key thing is going to be whether or not it differentiates itself in some way because of its different biology. What we don't know from any of the CDK4/6 inhibitors is what impact it's going to have on survival. And we may never know that question because the studies weren't powered to detect survival differences. And also, many of these patients get so many different treatments following their progression. In fact, most of the rest of their survival time is probably on other drugs. And so the variability there may make it very difficult for us to ever know. So we look forward to other studies with abemaciclib. There are some studies that are focusing on CNS disease. The neoadjuvant study with abemaciclib, the NEO-MONARCH, was very interesting. It showed some interesting changes in the cellular environment, particularly the infiltration of lymphocytes, which makes you wonder whether combinations of CDK4/6 inhibition with immunotherapy may be a benefit in the future, and those types of studies are being pursued.